Hey, I'm Lacey.
And I'm Laura, and we're surgical coordinators here at Advanced Cosmetic Surgery. And today we're going to be talking about brachioplasty scars, also known as arm lift scars. With brachioplasty, it is known that it is going to leave an incision, so essentially you are trading off having a much better shape to your arm for having a little bit of an incision there. So the answer is yes, you are going to have a scar. What we tell patients is that most of the recovery and the appearance of the scar is due to genetics. Thanks, Mom and Dad. But we do as much as we can here at the office to make sure that it heals as nicely as we can. We do use a special type of suture that's very compatible with skin tissue. Afterwards, we'll give you a medical grade scar gel to use. And then if it's not the color after it's totally healed, so 6 to 12 months down the line, then we can always hit it with one of the lasers that can help remove some of the color of it.
With a brachioplasty or arm lift, your scar size can vary depending on exactly what your needs are. It can go from the inside of the armpit area all the way down the length of your arm past your elbow. And we do our best, and I say we meaning our great surgeons here, do our best to make sure that the scar or the incision site is as precise as possible. And we just try to make it as thin as possible. Obviously, with skin quality, things like that, all of those factors, again, genetics, as Laura said, those kind of things will factor into how you do heal. But we do all the things that we can on our end to make sure that you heal very nicely, and then, obviously follow you during your post-op to keep those incisions looking nicely all the way through.
And I know one of the things that they tell the patient in the consultation is that they're never going to sacrifice the end result for a shorter scar. So it, as Lacey said, it may go all the way down to the elbow, and that's okay because in the end you're getting the best result. So we're never going to give you a less than great result for a shorter scar. So as far as the healing time, patients can expect to be very limited in their mobility for about the first 2 weeks or so, honestly. And it's hard when you're not able to use your arms. You don't realize how much you do actually use them until you're not able to. And so when you have that incision for the first 2 weeks, it is going to be red, it may be swollen, you'll be bruised there, and you just have to make very diligent decisions as far as the first couple of weeks and how you're moving your arms as little as possible, honestly, to make sure that you don't put any type of tension on that incision. Otherwise, then it can come loose, and that's going to give you not so great scar in the long run.
And so when the sutures come out, you can expect your incision site to be raised. That is very normal, but over time, the incisions do lay down to be nice and smooth for you for most people. How long it takes you to heal, again, really depends on you, your body, your genetics, and how all of those things kind of play together. Also, your recovery time and how you go into that recovery time, what you limit yourself to, all of those things are going to determine on how your body heals. Following post-op instructions, coming to all of your post-op appointments, those are very important things that you need to do so that we're able to follow you as you go through your recovery time.
One other thing to mention too is you're going to have a compression garment on your arms afterwards. So it's essentially like a long sleeve bra. It just helps to squeeze everything in. So it's super important that you're wearing that compression garment 24/7 except when you're showering for about the first 2 months or so after your surgery. Is the surgery painful? To be honest with you, any surgery is going to be a little bit uncomfortable, but this is really a skin and soft tissue operation. So there's not a lot of muscle manipulation there. So it's really not too bad in that sense that your arms can be a little bit numb just because they are doing some work there. But it's really not one of the more painful surgeries that we do.
So we always like to remind patients that when you are having surgery, it's kind of a trade-off. You are trading one thing for the other. So if we are removing excess skin from the arms, then know that you're going to have an incision there. That incision is going to form a scar. Again, we kind of throw it back to genetics and kind of how well you follow your post-op instructions, things like that. But, will your scar completely go away? We're going to say most likely not. You are going to have an incision site that is there. We do give you creams to help with the overall appearance of the scar. And, sometimes people tend to form red scars. That's not abnormal. It's actually something that we see quite often. And, in the event that the pink or the red color doesn't fade away as quickly as you would like, there are always different laser light treatments that we can do for you. And that really helps to diminish the redness and just help with the overall appearance of the incision site.
I know one of the things that the doctors say in the consultation is they can do the exact same surgery on 100 patients, and 60% of them will have a pretty good scar, 20% of them will have an amazing, fantastic, almost invisible scar, and then 20% of them are not going to be so great. And so it really is up to genetics. And the nurse practitioners are great in your post-op appointments about teaching you things that you can do like massage that'll help to put you in the best position for healing and eliminating that. So a lot of people have asked about doing a tattoo over the scar, which we don't really advise. Ultimately, it's up to you what you decide to do afterwards. But when you have that scar tissue there, it has the potential to be raised. It can also hurt a lot more just because you do have that extra tissue there. So we don't recommend or advise doing the tattoos over the scars, but we have other machines that can help you if you decide to do that and change your mind later on.
So we do get asked quite often, if I don't like my scars, if I don't like the way they look, can there be, something else that can be done for them? And the answer is yes. If you're unhappy with the way it looks, there's always some type of procedure, again, or laser, scar revision, something to that nature that can always be done to treat the incision site to make it, better for your appearance. And I would say the healing time is going to be likely the same as if you had the procedure. You may not be as uncomfortable during that time frame, but just keep in mind when we do a revision type procedure, you're going to treat it just like you did the first time.
Mm-hmm. Yeah, it's not super uncommon that people are unhappy with that scar, and that's something that the doctors can sometimes actually do under local and oral sedation, meaning we don't have to put you back under general anesthesia, just to do a little bit of tweaking for the scar, just to help it lay flatter or be less red or less inflamed afterwards. So definitely something that we can help with if you don't like that down the road. But we do want you to be happy in the long run. Thank you for watching our video on brachioplasty scars, also known as arm lift scars. Be sure to check out our whole channel on different types of surgeries. Remember to like this video and subscribe, and we cannot wait to see you next time for our next video.
Thank you for watching.